so much. A pause now for when it comes to the Johnson & Johnson vaccine. Colorado following federal recommendations to stop using the one-dose vaccine for now. Governor Polis hopes it'll just be a short pause.
Out of abundance of caution, we're following the FDA and CDC guidelines to hold off a few days until we develop the protocols and measurements to make sure that we can restore full public confidence in all three life-saving vaccines.
Now, nationally, there are 6 reported cases of blood clots in people who have received the vaccine. That's out of more than 6 million doses delivered. All were in women between the ages of 18 and 49. And the symptoms developed between 6 to 13 days after they got that vaccine. Rick Salinger joins us live tonight. And Rick, there might be a woman here in Colorado who has also suffered a clot.
It is possible, Karen. Centura Health reports that it is treating a woman who received a blood clot after getting the Johnson & Johnson vaccine. This as the pause is having an impact. University of Colorado law student Devin Case was supposed to get vaccinated with the Johnson & Johnson vaccine on this day. Now the pause could leave her in a bind.
I was disappointed because I'm in school and I'm planning to travel abroad to Australia to visit my fiance.
She was counting on the one-dose J&J shot because she didn't want a second dose to interfere with finals or her trip. The pause comes after 6 women between the ages of 18 and 49 developed blood clots after being inoculated. One died.
I'm 25 and it is definitely a concern that I have.
But less than 1 in a million people who have gotten that vaccine have developed the blood clots.
I think if you've already had a Johnson & Johnson vaccine and you are more than 3 weeks out from having the vaccine, I think your level of concern really should decrease to essentially 0 on this one.
Dr. Dave Nida advised to keep an eye out for headaches, chest pain, abdominal pain, or leg pain. As for Devin, she still hopes to get the J&J vaccine.
I think it's one of those risks that I think the numbers are still pretty low, and as long as ideally I would get it before I was traveling for 18 hours on a flight.
The chances of getting a blood clot from the Johnson & Johnson vaccine are far less than if you're in the hospital with COVID. The chances of getting it there far greater. Live in Denver, Rick Salinger, covering Colorado First.
Rick, thank you. And if you have our CBS Denver app, you are among the first to learn about that issue with the J&J vaccine. Our newsroom team sent out an alert this morning. You can download that CBS Denver app from Google Play or your Apple Store. Now, the rollout